Okay, everyone, there's a QR code here and a tiny URLs. So anybody who wants to follow along the slides and go back and forth themselves, can do so. Um, I'm Karl, as she said, so I am an investor in aging biotech, and longevity companies, and also I run the website, as she alluded to, agingbiotech.info, which is the best resource for finding out about the aging and longevity field. I'm active on LinkedIn and X, and you can find me in either of those places. Um, so for those not familiar with the aging and longevity field, the most important thing to learn today, if you don't know it already, is the geroscience hypothesis, which isn't really much of a hypothesis anymore. It's pretty clear. It's that the molecular pathologies of aging underlie all age-related diseases, and the age-related diseases cause 70% of all deaths. I think it's up to 75% now of all deaths in the world, and the majority of suffering. And so it's a terrible thing. And for hundreds of years, we've had a tradition of treating diseases only once they become full-blown diseases, sort of reactively. Everyone in the aging and longevity field knows that what we should be doing is treating the underlying causes of those diseases, which we now know are a shared set of causes that underlie most of the top killer diseases and top suffering diseases. So over the last half century, we've got clear science showing that aging is not an invariant ticking clock, but is actually malleable. It can be slowed down, sped up. Certain damages can be reversed. And the big problem in the world now is that the majority of the public just doesn't know this yet. It's the majority of the public doesn't know it, and that means the majority of politicians don't know it. So that this talk is going to be about how to fix that. And I'll just say that, the few people who do know have started commercializing this stuff. So there's now an active biotechnology sector, and it really only started in the last 10 years. So here's the key slide that the key motivation slide that everybody in the aging field has seen versions of. If you haven't seen versions of this, I don't have a lot of time to go through it in great detail, but you should study this slide for 2 minutes. The upper left basically shows that aging is the top risk factor. A couple decades worth of aging totally dwarfs all other risk factors for all the major top diseases. But if you look at the actual funding allocation of how society spends its research dollars, only 5% goes to this aging and longevity stuff of the for-profit venture money in bio and pharma, and only about 0.5% of government NIH money. So this is a huge misallocation of resources. So the big question in the field has been for a long time, what's going to flip that fact that the majority of the public doesn't know about this basic aging stuff. And everyone's got their favorite thing, and there's lots of people working actively on each one of these 9 things in white. Everyone has their favorite one, and there's loads of debate in the field about them and lots of discussion about almost all of these. And what doesn't get enough discussion, and what I'm going to talk about today, is the thing in yellow at the bottom, which is the fact that the pretty new, only in the last decade, really, biotech sector that's working on this is actually just starting to really get success. And it takes about 10 years to get through FDA clinical trials. So this is sort of when you would expect it to start, and it is starting, and nobody's really talking about it, not enough. Because the field has been making steady progress. The problem is the progress has been sort of steady up and to the right, but not hit that inflection point that really allows it to really switch and fix that misallocation of funding. So this is the key slide. Even especially for people in the field who are familiar with things, this is the stuff nobody's talking about that everyone should be talking more about. The field of 200, 300, 400 companies, biotech startups, have started to produce actual results via clinical trials. And so specifically, if you look on the right side, there are now 3 companies that have gotten they're legitimately aging and longevity companies that have gotten FDA approved therapies that really do treat a core aspect of aging through FDA trials. Those 3 companies have gotten 4 different therapies through. There's another 1 or 2 done by companies that aren't really aging companies, but bigger pharma companies. And then there are 3 companies that have actually gotten trials that have gotten successful phase 3 trials, and they're currently in regulatory review stage, which takes a short amount of time before the actual approval happens. But besides that, there are 14 companies that have gotten all the way to the stage of having 29 different phase 3 trials. And so I went through all these trials and I said, which ones have already failed, which ones are still alive, and which ones actually target core aging aspects and are likely to, in geroscience hypothesis style, treat multiple different age-related diseases. And there are 16 trials that have not failed. No, 14 trials that have not failed yet, and out of the 29. And so if you plug this into a little quick spreadsheet based on the best science on estimates of how likely a phase 3 trial is to succeed and result in an approval, you get that we basically now have 4 things FDA approved, 3 more coming with a high chance, and we should statistically expect another 8 in the next few years. Um, and then, of course, predicting farther out gets a little more uncertain, but the pipeline is big. We've got, hundreds of companies in preclinical. And so you can work back and sort of figure out that there's basically, I'll jump to the summary. There's basically a bunch of things on the market, a bunch coming in the next few years, and then a steady trickle after that. So you can go to agingbiotech.info/trials, and the top row gives you a list in detail of what each one of those phase 3 trials is and what happened. And the important thing is I went through by hand and verified that they're all attacking key aspects of aging that will generalize to multiple age-related diseases. And if this is a longer talk and a more biotech-oriented audience, I could go through each of these. But each of these things in yellow is really something that attacks a core aspect of aging. So that's it. So if we revisit that list of the things people think might change the narrative, one insight is that things that are likely to work or have been demonstrated to work are more likely to result in funding. So I think the last one is not getting enough talk, but there are several others on that list that people are working on that will have a succeed or not. And so these are going to be interesting things to watch over the next couple of years. That's it. Great.
Hey, Karl, I know you've already heard this before because we're on these calls, but for the record, and because I'm interested in your answer again, so many of these, it's very easy to get money, or relatively easy to get money if you have a new drug or a new device or a new omics-based marker process. But I would claim that we all kind of know that what's driving many of these aging factors in our population can be very simply addressed through, certain dietary restrictions, carb restrictions.
The lifestyle thing.
Yeah, the lifestyle thing. So my question is, but there's no money in it. Like there's no money in people not eating junk food or people getting out in the sun, and yet that could so much move the needle. So
sure.
We have a new director of HHS, which may be relevant here, but how do you see that playing out?
Talking about RFK Jr., I mean, yes, there's a couple big potential upsides, and the whole change in administration could accelerate things, and we'll see about that. Lifestyle, the important thing to say about life, so you're absolutely right. Lifestyle makes a huge difference. The important thing, the high level thing to say about lifestyle, and the longer discussion is we don't have time for, but is that lifestyle makes roughly a 10 to 15, maybe at most 20-year difference in human lifespan. And the therapies that these companies are making will be a bigger difference overall. So these will be able to outdo that. At least some of them will. And so, it is hard to get people to change, and that would really help more people live longer until we get these therapies. But that's a different issue. And so even if people did change completely, and what RFK needs to understand is that even if people did do everything he thought was right, this field is still important to fund because this is what's going to take us beyond that. In particular, I'll just say that this top category with the most approvals, I made a post on X and LinkedIn just about a week and a half ago that you should all check out. It's a treatment for ATTR. ATTR is the thing that kills 70% of people above the age of 110. And we now have 5 drugs FDA approved and another one in phase 3 trials. So it's the top thing that kills people over 110. So it's the first drug that's probably actually going to extend maximal human lifespan and get us beyond 120 years as the limit.
All right. Well, unfortunately, if you can do your heckling comment in 20 seconds, you can do it.
I think there is one important item missing on this list. I invite anybody who can help to work with me on this. It's a really beautiful, comprehensive exhibit about what is aging and science of aging for museums of natural history, which would travel the world and change public awareness. So if anybody, designers, scientists are interested, I've been working on this concept and I need help.
Yeah. Leon's talk yesterday mentioned that he wants, millions of different crazy ideas in the field. And, the flip that we need is exactly what's needed to actually get enough funding to do that.
Awesome. Thank you.